patient about her condition. The patient says that has headache, for instance. Exploration data, I can see, I don't know, no. Diagnosis, approximation, the patient will be fine. Treatment, painkiller. It's just a dummy example, got it? And save. Sorry, the diagnosis. Headache. Oh, headache. I don't know, something. Save. Medical consultation data has been saved. That is mean the step 2, finish it. At any point you can change it, of course. I can, or I'm going to, I leave it in that way. And step 1, basic data. At any point you can change it. For instance, a diagnosis, I don't know. Save. Medical consultation has been saved. And there is. And the step 3 is additional data that is optional, but here you can upload images, photos, and PDF documents. You can add as many additional data as you want and consider as relevant. Every section is collapsible, upload image and photos, upload PDF documents, and add additional data. I'm going to show you every one of them. So upload image or photos. Say one by one as many image or photos as you want. You can take a picture using your web camera, for instance, of your patient face, your his or her arm, leg, I don't know, whatever you want. At this moment it's not working in my case sorry, because my web camera is busy by the recording, but I can pick up image, for instance. I want to load, and remember, save one by one. Save. File loaded successfully. I want to load another, remove, pick, and for instance I want to upload this brain MRI. Open, save. File loaded successfully, and you can upload as many as you want, limited by the disk space in the servers. At this point we have in a very basic plan provided and offered by AWS that give us 30 gigabytes in hard disk drive. So, and that is the way that we can scale and expand the features of the server. It will depend on the demand on the user, number of users. I don't know, that we can study and we can sit with you and to talk about the particular infrastructure, if the application is going to be work as multi-tenant, also just one for each health center, one for each medical doctor. I don't know. This is totally how can I say it, in function. It will depend about your requirements. Got it? So the next is upload PDF documents. You can drag and drop PDF files. You can upload more than one PDF file. Use the icon plus to add files to the list. Use the icon clear all to remove a file from list. And use the icon upload to start the upload process. At most 20 megabytes per upload. So I'm going to drag and drop. Sorry, I have two monitors. For instance, I'm going to drag and drop this file. It says use the icon clear all to remove all file from list. For instance, once more, drag and drop. Use the icon plus to add files to the list. Plus. For instance, I want to upload this file, and use the icon upload to start the upload process. I'm going to make click Let me close this, and the upload process started. Files loaded successfully. Files to load, and you can see the percent of upload progress. 100% for all files, 100% for this file, for this file. You can, okay, got it, or you can remove all uploaded files. It doesn't matter if you clear your files that you already uploaded, because the files already are in the server. So you can continue, or you can clean up the list, whatever you want. I'm going to continue. And additional data. Save one by one as many fields as you want. What is intention for this section? For instance, I don't know, perhaps we have some data that the medical doctor don't ask you, don't require you previously in any other step. I mean, in step 1 or step 2. For instance, if the patient is married, name that will be assigned to the field, the value for the field, no value or content that will be stored in the field, and the description helps the user to know more about the field. You can have as many additional data or fields as you want, say one by one, in the same way that Ula measure for us. Save additional data, save it successfully. For instance, we want another field, children. It's not marriage, but perhaps she or he has 2 children, number of children, for instance. As the description, later we can see where this data is displayed. Save, and that's all. You can ask many fields as you want, like I said before. So what's the next? Well, that is all. And remember, the step 3 is totally optional. Only the step 2 and the step 1 and step 2 are mandatory, right? Totally required. So what's the next? Oh, well, what about search a medical consultation? You can find a medical consultation or see the patient history, and I'm going to show you one by one that you can also get access through services. Search medical consultation or patient medical history. That is the same that here. Search medical consultation 1, patient medical history, all the patient history. For instance, remember that the platform generates an identifier for the medical consultation. You can type it, and then you will see the autocomplete, and click and find this number. I cannot remember the, but you can print or you can give to your patients, I don't know, his identifier, and then the patients, the next time that visit, or just with his or her social security number, you can inspect the patient history that later I'm going to show you. So find a medical consultation, find, and there is the patient data card as we know it. Remember, the same social security number and the data, the notes, the previous detections, and the data for the medical consultation, basic data, the consultation data, additional data. You can see it, basic data, blood pressure, weight, all the data that we have saved before, consultation data, and the additional data. Here you can see the image that the documents that we have loaded, and the additional data of fields. Of course, you can make click in each image or photograph or photo, and it will appear in a new tab. It will open in a new tab. Got it? And you can save it. You can do whatever you want with the resources. The documents also you can open each document, PDF document that you have loaded previously, and the additional data fit. Remember the marriage. You can sort each column also by save it, time, by field name. Got it? And here is the marriage field value, no, the children field value 2, and the field description, number of children. That is the importance of that data related with field description. And this is all the medical consultation data. Who attended this session, you can see the medical doctor who attended, or the user that saved this data. So you can call, but this is not implemented yet, remember, well, close. What about if go back to the dashboard? Now we can see that we have last patients, the date that was added, the social security number, the name. You can inspect, see it, click to see the details. You can see the patient data card for Peter Pan, photo, social security number, the same approach for the patient data card. So we'll save this data and view change history. Once more, the change history related with the patient. So what's the next? Well, at this point we only have patients. We want to search and inspect the patient history. For instance, in this case, remember that's ABC, all the medical consultations, all the patient history. Got it? The patient data card, once more, click on the medical consultation date to see its full information, and the date to see its full information. This is the table with subjective data, analysis, exploration data, diagnosis, prognosis, treatment. You can click to see the date to see its full information. And this is once more the medical consultation data, the patient data card, and the medical consultation data. Remember the basic data, the consultation data, and the additional data. Correct? With the same approach. It's very similar, the user interface. You can see who attended the session, and you can close or go back. It doesn't matter. And you see also the identifier for that medical consultation, the start date and time, and things like that. Sorry. Well, what's next? The apps. Of course, you can create a new medical consultation as you want. For instance, I want to create another 1, 2, 3, another patient. I'm going to call it Pedro Paramo. I'm going to use the same. This is not validated because I don't know, perhaps this could be the same phone number, why not? But the email, yes, is validated that it will not be in use by any other patient. Email is already used. I'm going to change only for that and add Alzheimer detection, but you remember you can go back to the new medical consultation and then create a new medical consultation for that new patient. Fine. And this is I think that this is another thing that perhaps could be effect, because say it seems that is another headache. This is the previous data from the previous consultation. Save. And that's all. Going back to the dashboard, and then I have two medical consultations, two patients, sorry, Peter Pan and Pedro Paramo. Got it? And you can see their details by making click in any of these options. Search medical consultation, view patient medical history, 1, 2, 3. Yes. For Pedro Paramo, this is in the file, and then we have yes, got it, because there is issue that the identifier assigned to the new patient, but